Dr. Elgin.
Good afternoon, everyone, and thank you for joining us for NCNW's Health Equity Committee, COVID-19 Subcommittee, and Good Health Wins on our National Town Hall on COVID-19 and back to school. We are pleased to bring you today's National Town Hall discussion covering vaccines, families, children, and COVID in the classroom. The National Council of Negro Women is a Washington, D.C.-based charitable organization making a difference in the lives of women, children, and families through a four-pronged strategy that emphasizes entrepreneurship, health equity, STEM education, and civil engagement. Founded 85 years ago, NCNW has 300 community and campus-based sections and 32 national affiliates representing more than 2 million women and men. NCNW is committed to empower, inform, and uplift children and women in communities of color. As such, the Health Equity COVID-19 Subcommittee has designed a town hall with parents and children in mind. During the pandemic, we have strengthened our resolve to address the importance of how vaccines save lives, but to also answer important questions about children, vaccines, and going back to school. And we will do that today for you. Thank you for attending.
Greetings, I'm Shara Denton, National Chair of NCNW's Health Equity Committee and the first elected state president of NCNW Georgia. On behalf of the Health Equity Committee, we want to extend a warm welcome. Our committee consists of 6 subcommittees, which include breast cancer, HIV/AIDS, mental health, maternal health, affordable health care, and our COVID-19. Our COVID-19 subcommittee, which is chaired by Dr. Angelia Elgin and co-chaired by Sister Synovia Moss, have worked diligently to present to you all the COVID-19 series, Town Hall, Part 1. In collaboration with Good Health Wins, today's Town Hall series will focus on COVID and children going back to school. We hope that you are open and engaged with today's program as well as our future ones. Thank you for joining us.
As you may have heard, Dr. Cole was arrested in a voting rights protest in Washington on this week. But even as a trooper as she is, we know that she needs her rest. So I know she sends us her spirit and her thoughts. We will now go to Ms. Synovia Moss, co-chair of the subcommittee for COVID-19.
Hello, and thank you, Dr. Elgin and Dr. Shara Denton. I'm Synovia Moss, co-chair of the NCNW Health Equities COVID Subcommittee and project manager for the NCNW Good Health Women's Immunization Network, as you've heard, Good Health Wins program. NCNW is partnering with national organizations in our sections to increase vaccination coverage among different racial and ethnic adult populations currently experiencing disparities. We're advancing the CDC's national stakeholder strategy to advance health equity, emphasize the reduction of health disparities, increase vaccination opportunities, vaccination education, and the identification of the drivers of vaccine hesitancy. Today, we want to help build vaccine confidence for parents and families of children getting back to school. But a few housekeeping items for today's National Town Hall. As you've seen in our promotional material, we are hosting a couple of raffles today. Actually, we're raffling 19 $100 Visa gift cards, which we're giving away throughout today's program. We'll raffle 5 $100 gift cards at the end of our first panel, another 5 at the end of our breakout rooms, and please stay to the end where we will raffle off another 9 or 10. So please stay with us. Every registered guest name has been automatically added to our raffle wheel. A winner will be randomly selected and the name will appear on the screen, and we will send the Visa gift cards to the email address that you used to register. The winners must be present on the Zoom call today to receive the prize. So again, please stay to the end. Throughout today's town hall meeting, Please place your questions into the chat. We have a dynamic team of COVID subcommittee members and other guests from the National Black Nurses Association to help us answer questions that you may have. And did I also say that I'm the president of the Milwaukee section of NCNW, home of the NBA world champion Milwaukee Bucks? Well, while we're celebrating our NBA All-Stars, today we have our own NBA All-Star lineup that we are so happy to present to you today. These are vaccine experts. These are our vaccine all-stars who work tirelessly, have dedicated their work and their lives to parents, families, and community. They're on the front lines of COVID-19, and they're working to help end the pandemic. A special thanks to our partners at Vaccinate Your Family, our NCNW headquarters staff, our NCNW Health Equity Committee, and especially our COVID-19 individuals, subcommittee members, our state leaders, and our affiliates. Today, we're your fans, and we're in the stands cheering loudly to hear the wonderful and expert information you're going to share with our parents and kids. So today I have the pleasure of introducing our moderator, who is an amazing spokesperson, medical expert. He's Dr. Daniel Fabuyi. You guys have seen him on CNBC, CNN, MSNBC, Fox, ABC, the Associated Press. He's all over the place. He is on the Today Show, and he is here with us today as our moderator. He's also known as Dr. Dan, as a distinguished ER physician, biodefense expert, war veteran, media personality, former chief medical officer, and assistant professor providing strategic leadership in public health literacy, biodefense, disaster preparedness, emergency management, and business continuity of operations, both nationally and internationally. Dr. Fabuyi completed a residency at Howard University Hospital and served as the medical director for disaster preparedness at Children's National Health System. He was an assistant professor of pediatrics and emergency medicine at the George Washington University School of Medicine, where he earned his MD at the age of 25. He's board certified in pediatric emergency medicine and is one of the first and youngest African Americans appointed by the U.S. Secretary of Health and Human Services in the Obama administration to serve on the National Biodefense Science Board to provide expert advice and guidance on complex issues of preventing, preparing for, and responding to adverse health effects of public health emergencies, such as pandemics. He served as chairman of the anthrax vaccine work group and as special medical advisor to the FDA offices of the commissioner. He is so well known. He's a published author in various medical literature, and he delivers expert testimony to all of the committees on the Congressional Hill. But most importantly, we want to thank Dr. Fabuyi because he breaks it down to us in layman's language, and we're so excited that he's here to moderate with us today. Please welcome everyone, Dr. Dan.
Can you hear me?
Yes.
I believe I'm muted. Can you hear me clearly?
Yes.
Excellent. Thank you for that wonderful, wonderful welcome. Don't believe the hype. That's all I'm gonna say. Okay. Good afternoon to everyone. I'm excited to be a part of this process. I actually just had finished a shift, and I promised I would join to make sure that this is exciting. We have a lot of engagement. We're going to have great discussion, and also to be able to welcome our wonderful esteemed panelists who are going to be joining us in the discussion. So I don't know where we are in the run of show, but we're going to play it impromptu, and I'm going to be introducing our wonderful speakers once I get the cue from you all, and I will make that happen.
We will start first with Dr. Regina Milter-Rock.
All right. Hi, Dr. Regina. How are you?
I'm good.
It's
Thank
been a
you.
minute. It's been a minute. So I definitely want to do the intro to Dr. Miltier, just because I haven't seen her in a long time. She's a fellow of the American Academy of Pediatrics. She was a subject matter expert involved in media, especially media on children. She's done a lot of work in advocacy. I remember her from way back when I was a resident and a senior medical student, rotating through Howard and Children's DC and over Fairfax. So we go way, way, way back. And one of my mentors and advisors, I would say, as of back in that time. And she still continues to do some of the wonderful work. She serves as a medical officer. I believe she was actually doing some work with United Health Group and still does on advocacy and Medicaid care exchange, basically ensuring that we have access to quality care for our children. She's been on the four lines, literally. She's a powerhouse in the pediatric world and in general in the BIPOC community for all the wonderful work that she's done. She was even appointed, I remember, by Timothy Kane, Governor Timothy Kane, back in the state of Virginia, to actually deal with child fatality and other things that relates to children and children being neglected and abused and things like that. There's so many things she's done wonderfully that I can't even begin to give you credit, but please check out her bio. She's awesome. And it's a pleasure that I actually get to introduce you, because I remember I was a student and I've followed your footsteps and been involved in a lot of stuff. So welcome.
Hey, Dr. Dan, it's so good to see you again. It's been a long, long time. Thank you to NCNW for the opportunity to just speak to you today briefly on children, and hopefully we'll have a great breakout section. I'm glad that this webinar is today and not a week ago, because the information about COVID and children has been so fluid over the past week. So hopefully the information that we're sharing with you today is the most up to date, but who knows, by next week, it might be a little bit different. So I'm going to address the elephant in the room. Should children return to school? And the answer is yes. Children need to go to school. And we asked, why do they have to go to school? Many of them haven't been to school in the past 18 months. And so now we're preparing rapidly to send them back to school in August and some in September. For some children, going to school means that they get to eat. They get regular meals. For others, it's both a safe and a supportive learning environment. Supportive in that it's quiet. There are little siblings running around, the doorbell's not ringing, the phone's is not ringing, because that's the environment in which they have been learning over the past year. Or rather, let's say that's the environment in which they were trying to learn. Also, our children need provisions for mental health support and supportive services. Children over the past 18 months have been traumatized by loss of family members, families, social economic stability. Parents have lost jobs, family members have passed, they've had to move out of their communities, their stability has been disrupted. So they can get some of those services while in school. Now, we all know it's also, school is a venue for social development. They get to learn to interact with others, to fend for themselves, to develop their own ideas, and just to develop themselves as people. And finally, but not as importantly, but also importantly, when schools open, the community economic status survives and improves. And I never thought about it the way my husband explained it to me. He said, when school doesn't open, you don't need pencils, papers, books. The buses don't run, so you don't need to buy gas. If you don't have buses running, then you don't need bus drivers. If the children aren't in school, the people who prepare their meals don't need to come to school because the children aren't there. So it is a domino effect to the community when schools are closed. Now, when we talk about children going back to school, how do they do that safely? And as parents, as guardians of children, we should not leave this up to the schools. I never left it up to the school to be the master of my daughter's fate when she was in school. It is our responsibility. The first thing we have to do is to make sure we're vaccinated to protect our children. The Delta variant is very virulent. And the more I read about it, the more I hear about it, the more I talk to colleagues about it, this virus variant is very scary, even to me. We need to make sure that our children who are 12 years and older get the COVID vaccine. And as soon as the vaccine is approved for children less than 12 years old, make sure our children get that vaccine. If you have any questions, you should discuss them now with your pediatrician before your child goes to school. Set your questions to paper and send them to your pediatrician. Set up a visit with the pediatrician, but they're willing, ready, and able to answer your questions about your children returning safely to school. Know the provisions of safety that are being provided by the school system and your child's individual school. You have the right to know, talk to the administrators, find out what is being done in the school system in general, but your child's school in particular. You need to have the answers to those questions. You need to also follow the recommendations of the local health department and the CDC and the American Academy of Pediatrics recommendations for children. And I'm really so proud to be a member of the American Academy of Pediatrics because they came out strong. 2 weeks ago, this coming Monday, while everybody else was trying to decide what we're going to do, the American Academy of Pediatrics came out on guidance with safe school return. And that again means that all eligible adults need to get vaccinations. I would not let friends or family come into my home. If I were vaccinated, but my children weren't, I would say, no, you can't visit, love you to death, but until my children are vaccinated, no, you can't visit inside my home. All teachers and staff, students 2 years old and older must wear face masks indoors unless medical or developmental conditions prohibit their use. Now, I know school systems across the country, including where I live, are voting on whether or not masks will be mandated in their schools. And most of the schools in my area are saying, yes, you must wear masks. There are school systems where parents are fighting and saying, I have the right for my children not to wear masks if I don't want them to wear masks. Well, I want parents whose children are going to wear those masks demand their rights too, because their children need to be kept safe as well. Students should receive all of their recommended vaccinations, including influenza when that vaccine is available when they return to school, and follow the recommendations for the school for cleaning and disinfecting school spaces. So it is all of our responsibility, not that just of the health department and the school systems, to determine whether or not it's safe and how they're going to keep our children safe. It is all of our responsibilities. And as parents and those who love children, those who act like parents, aunties, grandparents, all of us must be informed, vaccinated, and ensure that our schools are safe when children return. So thank you very much, and we'll talk more about this in our breakout room later.
Awesome, awesome. Thank you very much, Dr. Miltier. It's great again to see you. Great points that were mentioned. I hope people were listening. So we'll get into our next speaker, Dr. Oliver Brooks, who I will introduce. We'll cue Dr. Brooks up. Dr. Brooks received his undergraduate in biology at Morehouse and his medical degree over at Howard University. Interesting enough, Dr. Brooks is the Chief Medical Officer and Past Medical Officer of Pediatric and Adolescent Medicine at Watts Health Care Corporation in LA, and also the Medical Director for LA Healthcare Plan. He also is a past president of the NMA, which is the National Medical Association, board member and chairman of Immunization LA Families. But most important, I want to highlight the fact that Dr. Brooks has joined Health and Human Services, HHS, on the COVID vaccine task force and is a co-chair for the California State COVID Vaccine Development Work Group. So in Dr. Brooks's work, and also as a board member of the Kidney Fund, but the most important and pertinent to this discussion, with this long list of accolades, just as all of our wonderful speakers, is regarding the COVID vaccine work, and that is important to what we're doing right here. So Dr. Brooks, I definitely want to welcome you, and it's a pleasure to meet you, and please take the floor.
All right, thank you very much, Dr. Dan. I very much appreciate that introduction, and good to have you here, man. Absolutely. I want to thank the National Council of Negro Women for hosting this forum. It is very timely. I want to underscore what Dr. Miltier Rock said. It's good we're having this discussion, but by Monday morning, everything we're saying may be different because things are moving very rapidly. But you can only know what you know at any given period of time, and we can present what we know today. I'm going to just jump around a little bit because there's so much information that can be imparted in the small amount of time I have. So I will co-sign what she said, Dr. Miltier Rock said. I think we should go back to school. Now, do note this Delta variant is out there. And there's a confidential CDC paper that's now leaked that came out yesterday that is showing that the Delta variant is very contagious and people that are vaccinated are spreading it. However, the notation is the case rate is 8 times higher among unvaccinated people. Hospitalization rate is 25 times higher. So in the end, even with this, you should get vaccinated. As it relates to coming back to school, she said the parents kind of need this. The children need to be in school. Parents need for their children to be in school. The teachers need to be teaching. The mothers need to be able to mother their children before and after school and to have their own lives. Some of the guidelines, I'm in LA County USD, well, LAUSD, Los Angeles USD, it's the second largest or largest school district in the country. So some of their guidelines, this is just coming out, is number one, they're going to test all students and faculty, staff, weekly, regardless of their vaccination status. All will be required to wear masks indoors, including PE that is indoors, not outdoor PE. You do not need to wear a mask if you're the only person in a particular enclosed space. Social distancing of 6 feet for children approximately 11 and older. For the younger children, it was 3 feet. That may have changed, but just want you all to keep that in mind. So this is what LAUSD is doing, and it's going to be different from district to district, but I think that's a basic guideline. Children. So very few children die from COVID. Very few actually get hospitalized. But there is this illness, MISC, multi-system inflammatory syndrome in children. Tends to occur by definition 6 weeks after having COVID infection and having certain findings, usually multi-system organ failure. The studies show that Black children are twice to 3 times more likely to get MISC. So when you're looking at, well, should my child get vaccinated, or when you're evaluating the status of what your child, what you should do, it's happening to our people again, just like COVID-19 did. So your child should be vaccinated because, again, we were at higher risk. Now, that being stated, there is data from the Kaiser Family Foundation. This is overall not Black. It tends to even be more so with African Americans. So when they asked the parents of children 12 to 17 years of age, because now there's a vaccine down to age 12, whether they would get their children vaccinated, 10% said only if required, and 25% said definitely not. So 31/3 are saying generally, no, I don't want them vaccinated. And then for those that are 11 and younger, there is a vaccine that is in development for them. Pfizer is going to be presenting to the FDA soon for a child indication. They asked, would you get your child if they were vaccinated that's 11 and under? 11% said only if required. 26% said no. So we are going to have an uphill climb as it relates to getting our children vaccinated. The studies on African Americans say that they are more concerned with problems with the vaccine than with the disease process of COVID-19. So as we message African-American, I'll say families, we need to harp on the fact that the vaccine is safe and effective, because that's where the hesitancy is. One or two other things. I presume it is known by those here that there is a side effect of myocarditis from the mRNA vaccines, the Pfizer and the Moderna. So that is significant, and it's being looked into right now. It's 10 times more common in males. Mostly it is mild. Many of the cases are hospitalized just out of caution. But the data is showing that for every million doses of the vaccine in females 12 to 17 years of age, you prevent 5,600 cases of COVID, 150 hospitalizations, 30 ICU admissions, and 1 death. And you had a rate of 8.4 per million of myocarditis. For the males, it's similar, but you have 84 cases of myocarditis per million. But again, you prevent 5,000 hospitalization, 5,000 cases, 50 hospitalizations. So the bottom line is the benefit outweighs the risk. That being stated, if you're a child, 12 to 17 gets vaccinated and they have symptoms like chest pain, shortness of breath, they should see a physician. And I think lastly, the thing I'm going to touch on is mandates. Mandates have been litigated to the Supreme Court and they have been upheld. So it is legally acceptable to mandate vaccination. The findings are, well, the exceptions: a sincerely held religious belief, a clear medical exemption, and then accommodation per the American Disability Act, the ADA. So as we move forward, and we are, some of us, a lot of you are leaders, if you believe that an approach is mandating the vaccine, then there is a legal footing for you to do that. Like I said, for the children, the study showed 10% say they'll get their children vaccinated only if required. So there's 10% right there. If it's required, they'll do it. So I think it is important for us to understand that. I think I'll just close with saying our job, the only way we're going to get out of this pandemic is through vaccinating. Even with the Delta variant spreading, the only two ways to get out of this is dead or alive. And if we take the chance of not getting vaccinated, we take the chance of dying. If you get vaccinated, your chances of dying from this or getting hospitalized or spreading it to other people is reduced by, let's say, 98%. So when you talk with people, when you think in your own head about all of this, the answer is vaccination. So thank you, Dr. Dan. I'll turn it back over to you.
Dr. Brooks, thank you very much. That was on point. You covered everything from the side effects to the policy piece, even avenues for us to move forward and how we get out this pandemic, considerations that people need to underscore and understand. So that was very helpful, and we'll get into more conversations as we have this breakout, but thank you very much for your excellent point. Next to the stage will be Dr. Feimster. Dr. Feimster is a board certified pediatric infectious disease physician and a health services researcher and public health practitioner. Background is from Yale. She got her biology degree at Yale and did her MD and PhD at Columbia University before she went to CHOP and did fellowship and training in infectious diseases, subsequently left there and is now the Global Medical Affairs Director over at Merck Research Lab. So Dr. Feimster, we welcome you. I'm sure you have great insight into all of this stuff as an infectious disease doctor, but also being in this space. So thank you and welcome.
Thank you. Thank you so much for this opportunity to participate in this important discussion. I think as fellow panelists have indicated, this really is an excellent time to have this discussion. Certainly the pandemic has impacted every aspect of our lives since it started about 18 months ago, and it does continue to evolve quite rapidly. At the very beginning of the pandemic, I actually was at the Philadelphia Department of Public Health. I was there for a few years in their division of disease control, and so it was a part of the response at the beginning when we were learning very rapidly about this newly identified virus and trying to communicate the best way to manage and mitigate a spread as information is evolving. And so, I'm speaking to you today as a pediatric infectious diseases physician, and through that experience, and these, the content, everything that I'm talking about are my own opinions. But I will say that one of the big challenges, of course, has been the rapidly evolving situation. As noted, what we knew a week ago is different than what we know today, will be different than what we probably know next week. And as we are, talking to our communities, thinking about what makes the most sense for our families, you have to manage all of these inputs of information and how it might impact our decision making. And so, I think one additional important element here is to consider the way in which we communicate and can ensure that we are informed and can manage this, all of these inputs of information, some of which is, reliable, and sometimes there is information that might be less reliable, and how do we balance between the two? And so I'm grateful for the breadth of expertise that we have on this panel, help us, talk about, well, how can I, trust the information that I'm receiving? So let's talk about what we do know. And again, I certainly do, echo many of the sentiments that my fellow panelists have already expressed thus far related to the importance of, getting our children back to school. And also, though, to be able to do that in a safely, and so that we can feel, confident in the safety of schools for our children, the safety of our communities. And certainly also, echo many of the comments, made related to the importance of vaccination. Vaccination is probably one of our most important public health interventions, and certainly is going to be, critical to our ability to get to the other side of this pandemic. And so I just have a few points to build upon what has already been discussed. It is very nice to kind of see the consistency in our messages today. But so, certainly, I think one big question is, vaccination is, going to be our most important tool. And, but there are, as Dr. Brooks has just highlighted, a large proportion of the population who do have questions about the vaccine, and who, have low intention, who, have declined vaccination, who, have, low intention to receive a vaccine. And so really understanding what some of the questions are about vaccination and concerns, so that they can be addressed, is going to be really, really important. And again, ensuring that we have access to good information to address those concerns. The COVID vaccines were developed quite quickly. And, usually vaccine development can take several years, but they were developed quite quickly. And that has raised a lot of questions. But I think it's really important to recognize that while these vaccines were developed quickly, they were developed quickly because this was a time when we did have a lot of resources that came together to allow that to happen. That, we were using, mRNA vaccines. They're a type of vaccine, that hasn't been used for some of our other routinely recommended vaccines, but it is a technology that is known and had been worked on for some time. And it's a technology that allows for faster development of vaccines. And, we are in a pandemic situation, so the ability to have a tool available quickly is important. And I think it's also really important to recognize that there weren't any steps that were skipped in the process, that all of the steps in clinical trials, all of those things happened, and that monitoring continues, right, as we're using these vaccines now. And so I think that those are important things to remember, especially when you consider the rapidity through which vaccines were developed. But in many ways, at least I like to think of it as it's an excellent example of the ways in which science was able to really come together to provide a tool that will help us address this pandemic. And I think we've had a discussion about some of the safety issues and effectiveness issues. And I think it's very, very important to consider, especially when we hear about, the question of breakthrough infection or some of the side effects that have been observed. Very important for us to continue to monitor for side effects, to remember what you are preventing and the benefits of vaccination and the potential for adverse outcomes related to infection that you're able to prevent through a vaccination. And so I always try to remember both of those things side by side. And so I'm also going to jump around just a little bit because there are so many topics to discuss. And then, I think I think also the important thing to remember about vaccination, as noted, these are vaccines that are highly effective at keeping people out of the hospital and from developing severe disease. And that is, is vitally important. And, while they're, is the potential, and with any vaccine, it's not going to be 100% effective. There may be the potential for someone who's fully vaccinated to become infected. The likelihood that they're going to become very sick or develop symptoms at all is greatly reduced. And so if that's the case, and they're less likely to be infected, then there's going to be fewer places for this virus to go. And so our ability to have high rates within the community is just going to be so crucial, especially as we have a variant like the Delta variant that is able to spread faster and more efficiently. When you have a more contagious anything, there are other bacteria and viruses that are highly contagious as well. Having high vaccination rates is crucial. So what does that mean for school when we're getting ready to go back to school? I think we've already talked about, the importance of, vaccination when they're for students ages 12 and older, for younger students when they're available, for faculty and staff, but then to also remember the other mitigation measures that will be very, very important and have been shown to be effective. And so, if you look at schools, and you look at, throughout our experience, the risks of outbreaks and in-school transmission, overall, it's been fairly low, especially when you have mitigation measures in place, mask wearing, distancing, ventilation. All of these things have been very effective in maintaining a safe school community. And this is, even before vaccines were available for school age students, vaccines available at all, really. And so, we are learning more and more about the dynamics of transmission in school, and there has been, fairly little in-school transmission noted. Often when cases are identified, exposure may have happened outside of school. It's much less likely to happen student to student or student to staff. And so, there are ways to ensure that we have safe school communities. And one way that we talk about it, I'm thinking of my kids' school, is like a Swiss cheese model, and then we have all of these prevention measures, and each of them work together to block the virus from being transmitted. And so vaccination, of course, will be one, wearing masks, symptom monitoring, we talked about testing, all of these things work together to ensure a safe community. And again, I think there are many, many, many examples of schools in a diverse range of districts, including those in which there's high community levels of transmission, that have been able to open and maintain a safe environment so that all of the other benefits of being at school can occur as well. So again, we'll have more time for specific questions, but I think I'll stop there. But thank you very much again. I'm really looking forward to more discussion.
Thank you so much. I'm trying to make sure you can see me here. That was very much appreciated, kind of figuring out what our next moves are, Dr. Feimster, in terms of what we have to think about with regards to the school understanding the importance of mRNA, breaking down also the fact that we've had this technology, or at least we've been doing research on it for several years. This is not something new. I think that was an important message to get people also comfortable and also understanding. And I think that you're mentioning that Swiss cheese model for people to understand there are different barriers that help us prevent a bad or untoward outcome. And also putting it in context that, while kids may have some infection, if we put some things in place, the risk is definitely diminished. And I think that's an important message. And we'll get to discuss that even more in detail. I want to go on to our next speaker, who is Karen Ernst, who's the Executive Director for Voices for Vaccine. She leads the charge of that and helping parents, advocate for healthier disease-free communities. VFV, our vaccine for Voices for Vaccines, is actually an organization that's supported, and I actually learned this too today. So I'm glad to hear what Karen has to tell us, by scientists, doctors, public health officials, and basically giving science-based information to make sure that people actually understand it in a digestible manner, and also being able to be that advocate on the forefront with regards to public health related issues on vaccine on the national stage. So Karen, please welcome. Excited
Thank
to
you.
hear what you have to say.
Thank you so much, Dr. Dan. It's so great to be here. I just want to mention that I am absolutely humbled and honored to be on this amazing panel with these incredibly smart people. And the other thing I always like to start off with is just sharing that I am vaccinated, my husband is vaccinated, and my adolescent son also got the COVID-19 vaccine. And other than my husband complaining a lot for about 24 hours, we're doing great. The other thing before I start talking about my prepared remarks is I just want to mention that, there's a common theme right now that there's a lot sort of in flux right now, that there's a lot changing. And it's important to know that things are changing not because scientists were wrong to start with, or people just want to make things more difficult for us now, but because the virus is changing. And we really have to keep monitoring it and changing what we're doing in response to it. And it's frustrating and we all hate it, but that's just sort of where we are. When we do look back on these pandemic times, we're going to need to acknowledge that a lot of the hard work and sacrifice for the benefit of the greater good fell on the shoulders of our children. Our kids were pulled from their friends and from their teachers who loved them and put in front of Zoom meetings for hours on end each day. For some children, the sacrifice was bigger than for others. They were taken from schools that fed them breakfast and lunch. While 20% of children showed signs of increased anxiety and depression, the number of children receiving mental health services decreased by 50%. Worst of all, over 1 million children lost their primary caregivers. When adults began getting vaccinated against COVID, they came back out into public and resumed their lives that they had put on hold. But our children under 12 still cannot get the vaccine. And way, way too many adults are still unsure enough about the vaccine that they haven't gotten it yet. So our children are still in a pandemic, remaining vulnerable because there is no vaccine for them yet, and because there are precious few communities with enough adults vaccinated to keep the virus away from our children. It's important to understand that it's not just COVID, though. In 2020, we saw a 40% decline in well-child doctor visits for children between the ages of 3 and 5, which is important because I'm going to be talking on the Birth to 5 panel in a moment. That means that kids missed about 12 million doses of non-COVID routine childhood vaccines. Children going to school in person this fall and their younger siblings who are already in childcare settings may be stepping into classrooms vulnerable to outbreaks of measles, which is 2 to 3 times more contagious than even the Delta COVID variant. All these consequences of the pandemic are borne inequitably, with disparities along racial and socioeconomic lines. Children do a lot of work, though, keeping us adults in their lives safe. During the pandemic, they did distance learning and avoided friends for us and play dates for us. Before the pandemic, their flu vaccines, their pneumonia vaccines, and their hepatitis A vaccines protected their parents and grandparents. We might not be able to point to the exact moment that our children did not bring flu home to us or did not pass pneumonia on to our parents, but we have definitely seen that when most children are vaccinated, the rates of these diseases go down for adults. And now our children are relying on us. They deserve to go to school and childcare. They deserve to be well. They deserve to have consistent, loving caretakers and teachers in their lives. So we need to get vaccinated, and we need to mask up again too. Access remains an obstacle in our work to protect our kids against COVID before they can get vaccinated. Sometimes that access means figuring out the logistics of getting vaccinated. It's important to remember that no one needs to show an ID or insurance card to get a vaccine in this country. Even so, we know that getting a vaccine varies. We know that getting a vaccine can depend on who you are and where you are. Sometimes access means access to good information. Misinformation, which is the accidental sharing of something incorrect, and disinformation, which is the distribution of something meant to lead people away from correct information, can leave people feeling overwhelmed and bewildered. Plus, it's easier to be scared out of acting than unscared into acting. So it's easier to be scared out of getting vaccinated than it is to be assuaged of your fears and convinced to vaccinate. Some people feel like doing nothing is safer than getting vaccinated, even though doing nothing means that you could catch COVID and get very, very sick. And sometimes access is access to trusted sources. We are much more likely to get a vaccine if we have a trusted bond with our healthcare provider or whoever else is recommending of the vaccine to us. Amidst trying to resolve these access issues, our children are relying on us, but we are not powerless to help them and to help those around us. We might be entering the hardest part of the pandemic, as a new variant is gaining strength, and those who are unvaccinated are those who are most uncertain about getting vaccinated. So we have to just start. We start by making sure we have the access we need to sources we know are both experts and people invested in our well-being, to information we know is backed by science and accepted broadly by experts, and access to the vaccine itself. And then we become access connectors. We become the people who know where others can get a vaccine, can find information, and can find someone they trust to talk to. And just a tip, a little listening and empathy can go a long way toward getting people access. But we also have to have some level of urgency about this, because our children certainly deserve our action on their behalf. And as a parent whose son missed most of his senior year of high school, I completely and totally co-sign the calls for children to go back to school in person. And I really look forward to those of you who will join me in the Birth to 5 room. Thank you, Dr. Dan.
Awesome. Can you hear me?
I can hear you.
Excellent. No, we appreciate that. That was awesome, Karen. That was definitely helpful to know the work that you all do, and I think contextualizing it with regards to some of the mental health issues that are involved with this whole process, the perspective of day-to-day kind of stuff that they're going to deal with in the school, and how it's important for necessary for routine function, but also for regular function throughout this pandemic, and how scary it is to families and to those who are actually even receiving and considering the vaccine. I think we're going to have fruitful discussion in this breakout session. So with that said, I want to thank you all for being here. We have an excellent panelist, as I said in the chat. Please take notes. These are considerations that we're all going to actually be facing yours truly too. I have three adolescents. Fortunately, they were able to receive the vaccine, but there are also others that are younger that don't have access to the vaccine as of now. We have to really figure out those things. CDC has guidance out. And as one all the panelists have mentioned and reiterated, please make sure you are aware that certain counties will not have masking. You need to advocate for through your leadership and through all the channels that you need to ensure that your kids are safe. And you have to ultimately make those decisions. And that's why we're giving you exactly information, actual scientific information, facts, not fiction, and not any of this hoax and anti-vaxxer stuff, but really just facts so you can make your decision. All right, well, with that said, I guess we'll go into the question answer for these wonderful experts on the panel. My job is so easy. All I gotta do is just make sure you all get the questions and my colleagues in the background who have been keeping us all together to be able to get through these questions. So I'll pass it on to the team to entertain the question and answer, and I'll also look in the chat too.
Okay, we are going to have our subcommittee member, Kenyatta Cole, that will facilitate the question and answer period for the panel. Kenyatta, I'm gonna turn it over to you.
Good afternoon, everyone, and thank you for joining. All right, our first question that we have for our panelists is, thank you for the wonderful information. If you have the opportunity, please address this information. Will the vaccine reduce fertility or increase maternal morbidity? That's question one, so I'll stop there. This is a three-part question. I'm not sure who wants to take that one. Dr. Brooks?
The studies showed that there was no effect on infertility. The ACOG, the Association of American College of Obstetrics and Gynecology, they say a pregnant woman should not be denied getting the vaccine. They recommend talking to your OBGYN, but in post-marketing, which is phase 4, which is after some vaccine is out, we have not seen a bad effect on pregnant women. And note 5% of healthcare workers are pregnant at any given time. That's a huge number. So it is generally recommended to be given in pregnancy, but I would say if you have any concern, talk with your OB.
And this is Dr. Dan, and in addition to what Dr. Brooks mentioned, there are studies that were published and actually released that actually looked at fertility, miscarriage, and bad outcomes in pregnancy, because as you know, there were people in the studies that were initially done by Pfizer and Moderna that actually they became pregnant, and they actually followed them long term. They published some of that data. There was no increased risk of miscarriage or problems with pregnancy. If actually, in fact, they actually showed that it was different. It was more common in those who actually did not receive the vaccine. So meaning in just the general population with the risk, it was slightly higher, but there wasn't a significant difference. What that bottom line meant is exactly what Dr. Brooks said. So there's evidence and information out there.
All right, thank you. The second part of that question is, will the vaccine cause you to be tracked or magnetized?
I love this question because I've been on the forefront dealing with, as many of my colleagues on this panel, I'm sure, have been dealing with misinformation, disinformation, which is, I think, literally the major public health issue. Even Surgeon General agrees with that. Yeah, so it will not cause you to be magnetized. We actually did it just for entertainment purposes, just to actually show that that doesn't happen. There's no chip in it. If anybody really needs to freak out or worry about these things, as I've said candidly on many different outlets, you need to worry about your cell phone. Throw away your cell phone, because that's how you're being tracked, real talk. And that's my perspective. It does not reflect the wonderful group here or CDC or any other governmental agency. I'm giving you my personal perspective on it, but no, it doesn't. It is a true fear, with all jokes aside, that a lot of people have. It's not going to make you magnetized. It does not turn you into Lucifer. It does not light you up. It does not relate to 5G, all the other wonderful questions that I've received, and conspiracy theories, but also concerns that people have. I'm done speaking.
All right, thank you. The next one is, are there any home remedies to prevent or treat COVID-19?
I'll throw in something here. Vitamin D has been vitamin D3. There is this pretty good evidence that it helps to improve your immune status. It doesn't really prevent or treat, quote unquote, but I recommend it. There is maybe even some evidence that people that get hospitalized get put on vitamin D in the hospital. The other thing is Black people have a higher incidence of vitamin D deficiency. There's some information that vitamin C is antiviral also that has some effect. I would go back to washing your hands. If you're going to do anything, wash your hands before you take your vitamins. And all of those things are good, but they're 1/10 the effect of the vaccine.
If I could too, I just want to jump in here and say one of the things to think about when people are thinking about how to prevent an illness is that in order to prevent an illness, your body has to have some sort of experience with it before, either through you getting sick or you getting a vaccine, which, the mRNA vaccines have a little spike protein that looks like the spike protein on the surface of the COVID virus itself. And so it'll recognize it later when the virus comes along with that. And that's why, as much as we would like to boost our immune system and take lots of vitamins and hope that COVID stays away, it really can't unless our bodies understand what that spike protein looks like. That's really the only way to prevent getting sick with COVID. And you have two choices. You can either, have a previous COVID infection or you can get vaccinated.
All right, so a follow-up to that was, can you take too much vitamin D?
You can. Vitamin D is stored in the body, unlike a lot of the other vitamins. Studies have been shown if you take 5,000 units a day, you won't OD. The best thing to do is go get your vitamin D level checked. Quite frankly, that's the real way to do it, is to do that. And then based on that information, you can then figure out how much vitamin D you need. But at a dose around 5,000 units a day, you will not OD. But quite frankly, people that are vitamin D deficient need to load up on it and then start taking 5,000 units.
Yeah, this is a great point made by Dr. Brooks. So too much of anything is bad, as saying goes. There are cases where people have what we call hypervitaminosis D and hypervitaminosis whatever, substitute whatever vitamin. By the way, vitamin D, as much as we call it vitamin, is actually not a vitamin. It is a hormone. And that's a different topic, but just so people are aware that, and it has effects on multiple parts of the body. And as all of my colleagues have mentioned, with regards to boosting the immune system and all those things. But also understand that you have to have been putting in this work ahead of time. When we don't do all the work we need to do, eating healthy, taking our vitamins, supplements, whatever you want to do to help boost, so to speak, your immune system or keep you regular. At the last minute, when we're kind of adding these things on, sometimes it's not really doing that much. And most vitamins actually get urinated out pretty much out of your body within 24 hours. Except for vitamin D, of course, which is, we've corrected and talked about that. It is a hormone, but it is called vitamin D. Just some educational pieces, but I think all that was all fine, all what Dr. Brooks had mentioned. And checking your level, I think that's, if we're going to underline something, go get your level checked. That's really it, because we know a good number of people, especially BIPOC populations, are usually vitamin D deficient. Thank you.
All right, we have one more question. What are the options for children that take the COVID Delta alert information serious and want to be vaccinated, but their parents who remain biased and hinder the child from receiving the vaccination? So again, the question is, what are the options for children that are interested in taking or having the vaccine, but their parents are hindering them from taking the vaccine?
I'm going to take a stab at that. As long as the child is not emancipated, the parents have the last word on that. there are certain areas where parents do not have to be informed of children health issues, and those usually involve sexually transmitted diseases. But for vaccinations, parents have to give consent. So until they can convince their parents that this vaccine is necessary, then they probably will not receive a vaccine unless declared emancipated by the courts.
Yeah, Dr. Milter, I wanted to add one other thing. Actually, correct me if I'm wrong, since you're very close to it. But I remember having this discussion in DC, where I am. There was a policy, and not even related to being an emancipated minor. Literally, they made an exception during and voted on this with regards to COVID-19 specifically, and they said, you know what, we're going to give it to them. It became an uproar. It was political football. I think they approved it. But it's been controversial. And then I think another state actually did recently, and that has been another thing where those kids of those age approved between that 12, the sweet spot of 12 and 15, even though we know it's approved for 12 and upwards, but that was where that sweet spot of where controversy was. What's your thoughts on that?
Exactly. And I think it's been seen in several courts across the country. And the judges have gone different ways. But even in the cases that have been approved, there's a lot of controversy, especially with the younger children, those that are on the younger end of adolescence. So that's still up in the air. And I don't know that we can say across the board, if I'm 15 and I want the vaccine and my parents say no, I can still get it. I think there's a lot left to determine who has the final decision and who gets the vaccine in an adolescent. So thank you, Dan, for those comments, because you were absolutely right in bringing that back to memory. But this has come up in several states.
All right, we do have some more that have come in. So one question is back to the vitamin and supplements. Does zinc help with COVID-19?
You know, there is some evidence that zinc, again, has some antiviral properties, so that's non-specific. The evidence is not very clear. My approach would be, quite frankly, just take a multivitamin that has zinc. If you want to take supplement that with more zinc, you can. I believe there's some evidence, but it's not strong. I would just say that. And that's viruses, not COVID specific.
Okay, let's see. It says my 9-year-old had COVID. Is she likely to get COVID again? Also, can she still test positive after quarantining for 10 to 14 days? And will she be contagious if so? So the first part is she likely to get COVID again? She had it and she is 9 years old.
Sounds like a Dr. Feimster question.
Yes, so I think we're still continuing to learn about the likelihood of reinfection after you've had a COVID infection. There, I think, have been there's been documented reinfection, but I think we're learning about how frequently that might happen. Whether it happens more frequently in children versus adults. But certainly having an infection, you have an immune response to that infection, so that is going to give you some protection, right, if you're exposed again. And I think what we're learning about is how long that natural protection, lasts over time. In terms of, how long you can continue to be contagious, how long you might have a positive test, the amount of time that you're likely to be contagious is the amount of time that you're asked to remain in isolation. And, that's why, we have that guidance, for the amount of time you should stay away from others if you've been infected, because that's the amount of time been noted that you can continue to shed some virus, and virus is living, like virus that can potentially infect someone else. But after that amount of time, you shouldn't have live virus that you're continuing to shed. In terms of a test, though, and I think this is an important question, so the test that we do, there are a few different kinds of tests that we do for COVID. So there's a PCR test that looks for, a kind of a gene fragment from the virus. And those tests are really, really sensitive. And so sometimes they can be positive, even if the virus is no longer alive. You can have kind of dead virus in your nose and you still might have a positive test because it's just picking up a little piece of that. It's not like a culture where you're really looking for a living a virus. So you can have a positive test that might last for some time after your infection, after you've recovered, and after you're no longer contagious. And I think that's one of the reasons why, if you have so recommendations for, like, if you're traveling or getting a screening test, if you've known that you've had a recent infection within 3 months, that getting a test is not necessarily recommended because it could be positive and not give us helpful information. It could be related to that prior infection. So hopefully that answers all of those questions. But that's a hard part about a test, especially for a virus, because it doesn't always mean that it's kind of living virus. So,
and if I may add to what Dr. Feemster said, everything she says is correct. So what it comes down to is you're generally contagious, we feel, maybe 10 to 14 days after you've gotten it. So if you're trying to figure out whether your child could give it to somebody else, testing won't help. It's 10 days after the symptoms are gone away, that child or adult is generally not felt to be contagious. But that test could be positive for weeks and weeks later. So we don't even test anymore to look for whether or not you're still contagious. We do the timeline from the end of symptoms plus 10 days. And that's it.
Yeah, that's right. Thank you, Dr. Brooks.
Okay, thank you. Our next question is, how should I guide my college-bound child to quarantine before he or she comes home to visit?
I'll take that one.
I was like, who wants that?
Well, quite frankly, if the child is vaccinated, or the young adult, I guess, as a college student, they don't need to quarantine. And the others can correct me if I'm wrong, because again, these things keep changing. Mm-hmm. But fully vaccinated people, even if they're exposed to active COVID-19 or where someone's truly infected, you don't need to quarantine. I would also hope that they're coming home to a family that's vaccinated. So that's also the thing. If you're bringing your child back in from college into your home, you should be vaccinated. If everyone in the house is vaccinated, the child is vaccinated, you don't need to quarantine.
And this differs from last Christmas when college students were coming home and we didn't have the vaccine. Right. And I think that might be some of the confusion. But more and more of the colleges and universities are now requiring their students to be vaccinated before they can return to campus, along with their faculty and other staff members as well. But I think the confusion comes from last Christmas, last Thanksgiving, when we didn't have the vaccine and students had to quarantine when they got home in their rooms in the basement with food being pushed to them. So we do have the vaccine this year.
You were saying they were in jail pretty much?
Yes.
So I think I'd like to add to that. I think it's important a message that it is a dynamic of change. This thing is, it's really a changing message. So just as you get used to something, we then flipped it around again, but we're reacting to the virus. The virus is changing, so we have to adapt and react. I think another piece that we haven't interjected, and I just want to throw in there, is masking as it comes to that. So we need to now figure that out, because if they're returning to an elderly family, to their grandparents and things like that, even though they may be vaccinated, and we know that the viral load with the Delta variant seems to be higher, or if they have someone who's immunocompromised, we probably should make sure that they're also masking indoor, even though that's already the guideline. So I'll put that in there as a caveat in addition. I'm done.
All right. Okay, so we have another one about if my child is still quarantining from having COVID and I test negative and have no symptoms, can I get vaccinated or do I need to wait until her quarantine time has finished? My child is still quarantining from having COVID and I test negative and have no symptoms. Can I get vaccinated or do I need to wait until her quarantine time has finished?
The manufacturers would say you can get vaccinated, period. And even the broader question becomes, if you tested positive for COVID, when do you vaccinate? So that the official recommendation is anytime. But my recommendation is generally waiting 60 days, maybe even 90 days, let's say 60 days. So to answer their question, yes, if they don't have any symptoms, their child is quarantining, they can get vaccinated now. Note that it's not going to stop them from getting the COVID from their child, because it takes, if it's the J&J vaccine, it'll be 2 weeks. And if it's Pfizer or Moderna, it's going to be 2 weeks after the second dose. But I would still say, yeah, I mean, basically, if you have a chance to get vaccinated, and the sooner the better, because every day you don't get vaccinated, you're more likely to get infected. So that's how I would answer that.
All right, anyone want to ask that? Okay, our next question is, our health district director is asking that those that are fully vaccinated to wear masks when in groups and maintain social distancing. Do you agree with this? The health director is asking that those are fully vaccinated to wear masks when in groups, maintain social distancing. Do you agree with this?
Yes.
Someone else
CDC guidelines is out there. We can't say
Exactly.
nothing more.
Well, not only that, this Delta, again, the paper, it's in the paper today. If you all look, this confidential CDC leaked document. Delta is out there. It's very contagious. The people that are vaccinated get it and they spread it. They just don't tend to get hospitalized, but that's now. It may be next week that they're going to see more hospitalizations. So do note that this is so fluid. And this information, again, is as of today, yesterday. We have to have high respect for that Delta variant. Now, I would say if everyone in the area is vaccinated, like if you're in a room with 5 people, everyone's vaccinated, that's kind of a tougher call. I think that the guidance may now be wear a mask, but vaccination status matters. But with the Delta variant, it seems like that's starting not to matter anymore. Mm-hmm. So it's ask us next week. Mm-hmm. I would say in general, wear a mask. I mean, it's the safest thing to do. There's little downside. If you need to eat or drink, eat and drink, and then put your mask back on.
Yeah, I think that's right. And I think the recent guidance about wearing masks indoors, regardless of vaccination status, is also supposed to be tied to what's happening in the community. So you have higher rates in the community, of course, that increase the potential for exposure and spread. But generally, I agree. I think it's a good strategy because it speaks to the Swiss cheese model in some ways. So you have 3 if you're also distancing. Prevention strategies in place. And I think with Delta variant and as things are continuing to change, that might be important. And yes, if everyone is fully vaccinated, that really does reduce the risk a lot. But I think the challenge is, especially in larger groups, when it may be harder to know what everyone's status is, that the safer thing to do is, especially indoors, is to have a mask on. So.
One of the things I saw a few weeks ago when I went to the grocery store was a gentleman with his 2 young children, and they looked 8, 10 years old. He had them masked up and was very attentive that their masks were in place in the middle of the grocery store aisle. But interestingly, he did not have on a mask. Mm-hmm. So, I'm thinking, sir, you're trying to do the right thing, pulling and tugging on their mask, but you can still become infected. And when they get home and take that mask off, you're going to infect them because obviously they were too young to be vaccinated. So masking is very, very important. And as we talk about protecting our children, as the school systems are saying, everyone in the building must have on a mask, especially in the areas where children are less than 12 years of age and aren't eligible for the vaccine. So we have to do that as parents and guardians of children ourselves. We're vaccinated, but they're not. And we can still carry the virus. And really with the Delta variant, from what I'm reading, the nasal viral load can be very high, even in vaccinated individuals.
All righty, thank you, thank you, thank you to our panelists. We have had a wonderful discussion. For those questions that we did not get to, we will get answers out to you and make sure they are available. I would like to thank Dr. Soren Wells for helping me with the chat and the Q&A. Dr. Dan, I'll turn it back over to you.
All right, no, thank you very much, Kenyatta. And thank you to our panelists for engaging in the conversation. Thank you for our audience who've been posting lots of questions and sharing that with us. And I hope that was helpful for you. So we're going to wrap up this session and then break out into our breakout session. But before we do that, I'll give my 2 cents remark. I want to underscore everything that our wonderful expert of panelists. Please check out their bios. Make sure you follow them. And panelists, please in the chat, put your maybe Twitter or IG handle or whatever social media or contact information so people can engage with you also. This is a great group and useful information, relatable, understandable, and it's personal. So my thoughts and perspective on this whole topic, yes, you have to get your children vaccinated. It's our only way out of this pandemic. We've been talking about this, but it's a bridge moving forward. Let me kind of get it down to up to the 30,000 foot view and then bring it back down. So in my opportunity and fortunate opportunities I had, I get to work on the global scale, on the national scale, on the local scale, and in the ER in the community. So I see the patients, the end user, but I also was involved in the policy stuff. So I get it all around, and international parents, immigrants from Nigeria. So I've been overseas. I know what it is when we go volunteer and do things to help other communities. We have 195 countries. Less than 2%, as of 3 weeks ago, have people who are totally vaccinated. The whole vaccine, less than 2%. So understand that SARS-CoV-2 is here. It's here for a while. It's not going anywhere. We have a lot of work to do. We're only as strong as our weakest link. We have lots of communities that are clamoring for the vaccine. Yet we in the land of opportunity are, kind of shucking and trepidatious about a vaccine that we've had enough data, enough time to ponder. You've had health experts saying they're taking it, they've given it to their families. You don't go to a mechanic and say, hey, I'm a doctor. I think you should do it this way. I listen to the mechanic. They know what they're talking about. I may learn about it and read about it, but I'm not going to know as much as that mechanic who's been doing it for years with experience. So we all have to give ourselves grace and humble and have some humility, but also know that we're looking out for everyone. Yes, the medical community has violated the trust of the BIPOC population, no doubt. Yes, the government has violated the trust of the BIPOC population. Do not get it twisted. We are not confused. We are aware there is an injustice going on, but we also have to get through this so we can address those things. But if we're still in this quandary and circling the wagon and don't get this thing done, it's a problem. Our children are at risk. They're our precious gems. This is very important. It's really critical when it affects our kid. It takes only one kid to get a severe illness or die, and it wakes up a community. So understand the importance of this. This is really real. This is no joke. When I first got my vaccine in December, I posted that on my IGTV. My kids, when I came home, because I was staying in a hotel, literally doing shifts because I did not want to get them exposed. When I finally got my vaccine, I was comfortable, mask and everything. Finally got to see them. I told them I got it. Like, you got the vaccine? Why? I said, Dad's been doing this work in this area for a long time. Dad knows the importance of it. So you're going to listen to me or you're going to listen to other people? And they got around and were able to actually convince their mom, who we had the discussion too, on getting the vaccine, and they all got it. But it was a discussion. So let us tell our story. Let's have the discussion with our loved ones, heart to heart. I don't want it to cause conflicts, but it is a tough subject. There are situations which we just heard about where there are teens who may want to get the vaccine and families may not want them to. And how do we bridge that and help them to get that information and the accurate information? What are the pressure points? Who is the messenger? Who's the right messenger? Who are they listening to make sure that we do that? So our responsibility is to get that information in front of them, not be judgmental, but give them their information, pray for them, get them to the right resource and find that true messenger that really touches them. There's lots of stories, sad stories, with patients coming into the hospital and on their dying or laying bed or sick bed, they're requesting for the vaccine. It's too late. Medicine doesn't work after death. So I think that's important to raise to our families, but also to our administrators. Hold your leadership accountable, your mayors, your leaders in your communities. What are they doing? Are they really supporting the fact of masking? What are they doing in terms of policies within schools, communities that don't have access to a lot of funds? All those things, we elect them. So get involved. Do not just rest on your laurels. It's coming. It's only in 2 or 3 weeks before we start school back up. And there's going to be a lot of price to pay. Please make sure you're not part of those prices. Get to your loved ones. I'm done speaking. And thank you for being here.
Thank you so much, Dr. Dan. It is just in all of our panelists. What an amazing presentation. And thank you for your words of wisdom and for being truth tellers to our community and especially to our BIPOC community. We are all winners because we've had the opportunity to hear firsthand. And for those who were not able to join us today, we will upload a recording at ncnw.org and also www.goodhealthwins.org. So you will be able to share this valuable information with family and friends alike. As I've shared, this is the dream team. This is the dream team. You guys are amazing, and thank you for all the work that you do. And now we're going to have some real community winners as it's time for us to do our first raffle. And so we ask that you all will please stay with us, as when we return, we will start on our breakout rooms. But right now we're going to put our raffle wheel up and we are going to begin selecting our winners. Actually, I just want to make a correction since we are in the public domain. We are giving away $100 gift cards. And so our first winner is going to be Brenda Land. You are our first $100 winner, Brenda Land. We will send an electronic notification with your amount, with your Visa gift card. Our second winner, let's spin the wheel. And these are $100 gift cards. The winner is Deborah Graham. Deborah Graham, you too are a $100 winner. Our third winner. Our third winner is it Fayreen Colbert? Fayreen Colbert, our third winner. And as I said, we're all winners because we've had great information, but let's spin that wheel again. Our next $100 Visa gift card winner is Lauren Poteet. Lauren Poteet. Congratulations, Lauren. You will receive a virtual gift card for $100. And we're going to do one more, and then we're going to start in our chat rooms. Thank you all for being so patient and for joining us on today's National Town Hall. This is the first of 4. And our next winner is Robin Bakel. Robin Bakel, thank you so much. And back to you, Dr. Elgin.
Thank you, Sister Moss. So we have 5 winners. That is awesome. Thank you so much. we are going to now move to our breakout sessions. We have kind of moved the strategy to going to each breakout session one at a time. So the breakout session that we will do first will be birth to 5 years old. Birth to 5 years old. That is our first breakout session. The moderators for that session will be Sister Amina Woods and Sister Sharon Jackson. We have expert residents, Ms. Karen Erst and Dr. Regina Milteer Rock, birth to 5 years old.
Good afternoon, everyone, and thank you all again for being here today. We have some childhood vaccine questions pertaining to ages birth to 5 for the two panelists, Karen Erst and Regina Milteer Rock. And as a reintroduction, Ms. Ernst is the executive director for the Minnesota-based nonprofit Voices for Vaccines. Dr. Milteer Rock is the senior medical director with United Health Group for the Medicaid and Exchange populations. We will alternate your questions between our experts, and we have about 10 minutes for this session. So the first question that we have is, if my children are wearing masks at school, why do they still need to get vaccinated against other diseases? Won't the mask protect them?
I will be happy to address that. We have had childhood vaccines for many years, and I'll tell you that some diseases in our communities have been eradicated because of vaccines. So diseases such as measles, mumps, rubella, tetanus, they have all been eradicated because we've had such polio, which is devastating, including diseases such as H-flu, influenza, which causes meningitis in young children. So these diseases are usually respiratory spread, except maybe your rotavirus, which is a GI virus. So though they're in the classroom and they're vaccinated, they're in the classroom and they're wearing masks, it's not 100% protection. And we know children, they do a lot of hand, face, mouth contact with themselves. So if they should be in contact with children who have not received these vaccines and who are carriers of the infectious diseases, then your children too could be infected. But let's be a little bit more realistic too, because children in public school, K through 12, have to show proof of vaccinations to enter most school systems, unless they have an immunodeficiency disorder or the family has religious beliefs that will prevent them from being immunized. So no, the masks are not 100% protective, though we have seen that there was no influenza in the community this year compared to other years, because one, we were all separated, we socially distanced, many of us were working from home, and two, when we did go out, we wore masks. So that tells you that masks can be effective when properly worn, but they are not 100% protective against infectious diseases.
Thank you. Okay, so we have another question. I lost my job and thus my insurance. Is there any program to help cover the cost of my child's vaccines?
And I think both of us will probably have answers to that question, but yes, you can go to your local health department, and many of them will give free vaccines or sliding scale payment, where you pay based on what your income is. There are also federally qualified health centers in communities that also will give free vaccines if one is unable to pay, or again, a sliding scale. So because you have no insurance and maybe funds are very low, your children can still be fully vaccinated through the health department and your federally qualified community health centers.
Right. Yeah. And I'll just add to that, that the program that you want to ask your provider, if you have one, or the healthcare centers, you want to ask them if they have the vaccines for children vaccines. And those are the ones that the federal government purchases for children who do not have insurance.
Thank you. That's also true. Thanks.
Thank you, Dr. Miltia Rock and Ms. Ernst. Another question, do you have any tips on helping my child through the actual vaccinations? It's so hard to see them cry.
None of us want to see our children cry. You know, I've given many vaccines in my career, and I think it's sometimes with the very young, it's more the act itself. It's a quick sting, as we all know, and it's done. You know, it's not a 5-minute process. But I think even with small children, you know, you hold their arms, you hold their legs. Mom is standing over them, very intense. And so it is a little bit frightening and maybe exaggerates their responses, but it's an unknown to children. So it stings for a second. They may cry for a minute, but the one moment of discomfort, the 2 minutes of crying, are well worth the protection that they will receive from their childhood vaccines.
And I do want to just add to that, because there's a wonderful group that does work on needle-related pain called the Meg Foundation for Pain. And that's just megfoundationforpain.org. I'm not affiliated with them. I'm just a fan of theirs. And they have a lot of great tips about how to manage vaccine pain for children.
Thank you. And I think we have time for one more question. If my child is exposed to a person with COVID, should she or he be tested?
You know, I've just had this question asked just recently. The child came home from camp with a fever and said they felt very tired, and it was a child less than 10 years of age. So yes, the child did get tested. Unfortunately, the test was negative. As we know, there's a respiratory virus in the community, even RSV in the community, which we usually don't see until the fall. All of the viruses were arrested when the children stayed home and they weren't intermingling. So, you know, if the child is symptomatic, and this child was, and the family went and had a COVID test done, you know, it really depends on the circumstances too, if the child is asymptomatic, but most parents want to know. And as children go back to school, I think there are going to be a lot of tests requested, because as soon as they go back to school, the noses are going to start running and they're going to get the upper respiratory infections. So I think parents are going to err on the side of caution to make sure that their child is not infected, and also to prevent spread within the home. Because remember, there may be younger children there, even infants. So most parents are going to want to know. Maybe Karen has a different opinion, but I think parents are going to get their children tested. And I'm not in disagreement with that.
Yeah, I mean, I guess I would just add that, you know, taking a kid in for a nasal swab is really hard. And I think we all really want to avoid that whenever possible. So I think maybe the answer people might be looking for is, no, you don't have to do that. But at the same time, we really want to protect our families and our communities. And that's, you know, that moment of pain, just like the vaccine, sometimes is worth it.
Yeah, and I know some of the testing areas that do young children actually will show the parents how to do the test and let the parents do the test rather than a stranger during the test in the nasal cavity. I don't know how many of you have had the test, but I had to get the test because I was going to have a small surgical procedure back in January. And I don't know if I, had stepped on this lady's foot somewhere in the past, but she really went after me with that test, or at least that's the way I felt. So I think having the parents do it, as long as it's being observed and done in the way that it should, is less traumatic for the child. But I'll tell you, the vaccine was a lot less traumatic, even with the mild side effects that I had after the second one, than that nasal swab. She hated me for some reason.
Thank you. And I'm told that Dr. Brooks has a response as well.
Are you, oh, you know what? I think I inadvertently did. I would say this, as it relates to testing, okay, just so you know, you tend to test 5 days after exposure, because again, it takes time to convert. So if you're gonna test, you don't go to get them tested the next day. Number two is what type of exposure. Prolonged exposure generally is felt to be 6 feet or less for 15 minutes or more. So if it's not that type of exposure, you're less likely. And third, a general way that you can do without testing is quarantine for 10 days. So that's also a choice in terms of the general exposure, not just children, any exposure.
Thank you.
Yeah, and just to add, Dr. Brooks, it's a little bit hard to quarantine a 5-year-old or a 7-year-old.
Absolutely.
It's not going to happen.
As a pediatrician,
Yeah, it's not going to happen.
Thank you. So that's all for our Q&A for ages birth through 5 years old. I'll turn it over now for Q&A for school age through high school with moderators Marie Anderson and Candace Daniels. We can't hear you, Marie.
Marie on mute. Okay, so I'll start. Hello, everyone.
Hello? Hello?
There you go.
Good afternoon, everyone. I'd like to thank everyone for being here, and I'd like to reintroduce our speaker. We have Dr. Kristen Feemster, the Professor of Pediatric, the Division of Infection Disease at the University of Pennsylvania, Perelman School of Medicine. So the first questions we have today for the school age to high school is, why does my child need to be vaccinated against HPV, a sexually transmitted disease?
That's an excellent question. So, HPV is, an important, it is a very important vaccine for adolescents to receive. HPV is one of the most common sexually transmitted infections that, almost everyone is probably exposed to at some point in their life. And it is the cause of cervical and other genitourinary cancers. And the important thing about early protection is that the likelihood of being exposed to and getting infected with HPV is shortly after one becomes sexually active, and that for many people can occur during adolescence. And so, getting your HPV vaccine when you're receiving your other adolescent vaccines is an excellent opportunity for prevention, before exposure, because before exposure is key. And so that is why it is part of our adolescent vaccine platform, and really it's to ensure early protection before exposure. And that's the way that we can really have an opportunity to prevent HPV infection and associated cancers. And those don't occur till several years often following infection, but again, prevention is important.
Mm-hmm. Thank you. The next question we have is, what is meningococcal disease and is my child really at risk?
So meningococcal disease is caused by a bacteria. It's a bacteria called Neisseria meningitidis. And so it is a bacteria that can cause pretty serious infection. It can cause meningitis. It can cause an infection of the bloodstream that can make you really sick. Sepsis is what it calls. It has been caused, and it is an infection that can sometimes lead to death. It can make you sick very, very quickly. It is not the most common infection, but when it does happen, it can make you sick very, very quickly. And what we call the kind of case fatality rate, or the amount of infections it can lead to bad outcomes is pretty high. And so, for that reason, being able to prevent that infection can be very important. When you look at who's at higher risk, it tends to be adolescents and other people who might be living kind of in close quarters. And so it is an important part, again, of that adolescent vaccine platform, because again, you want to be able to prevent this infection at a time when teens might be at higher risk. And so that's what meningococcal disease is. And it's something we hear about it sometimes in the news. Sometimes there are outbreaks on college campuses where you can have a cluster of cases. And so that's what meningococcal disease is.
Thank you. The last question I have is, can my child get all of their adolescent vaccinations along with the COVID vaccine? That seems like a lot of vaccines at once.
Yeah, that's an excellent question. There have been a lot of questions about, being able to get COVID vaccines along with other routinely recommended vaccines. And so at this time, the CDC, the immunization committee that makes our recommendations, they have really said that you can, if you have somebody there, they're getting their routine vaccines, can also get a COVID vaccine at the same time, just because it's really important to make sure you take this opportunity to get kids up to date, and also to provide COVID vaccination as well. And so I think, as we talked about earlier in the panel, for many different reasons, immunization rates have decreased significantly in teens and younger children. And so now, especially as we're preparing for back to school, this is the time to make sure we can get everybody up to date, and then also provide COVID vaccination. And generally, because this is a question we get frequently, like, how many vaccines can one person take at once? What does this do to our immune system? And our immune system isn't able to handle, the vaccines that are recommended to be administered together. So take the opportunity.
Mm-hmm. Well, thank you so much, Dr. Feemster. This was such valuable information. At this time, we're going to move to our college panel, and I'm going to turn it over to the moderator, Dr. Marilyn Brown.
Good afternoon. I was muted. Good afternoon, everyone. Thank you for joining us. There are a lot of questions. So today, our expert residents will answer your questions regarding collegiate and young adults. Our expert residents are Dr. Oliver T. Brooks, allow me to reintroduce him, Doreen Lowry, and Dan Fabui. Dr. Brooks is the Chief Medical Officer and past Chief of Pediatric and Adolescent Medicine at Watts Healthcare Corporation in Los Angeles. Dr. Lowry is the Director of Pan-African American Studies Program at Arcadia University in Glensdale, Pennsylvania, where I'm from, and Assistant Professor at the Department of Sociology, Anthropology, and Criminal Justice. And Dr. Fabui is Chief Executive Officer of Uritin LLC, and we will begin asking questions. Thank you guys for joining us. Go
Thank you.
Pennsylvania.
Our pleasure.
Hey, Glenside.
Okay, so our collegiates had questions about dating. One of the questions states, I'm fully vaccinated. Is it okay for me not to wear a mask on a date? How do I engage a person about COVID-19 and vaccination without scaring them?
Well, I'm definitely going to jump out on this one. It's funny, I had these conversations not only with teen adolescents dating, but even adults. And on a platform, Clubhouse, we actually get into the nitty gritty. So I'll put these out there as quick little answers. One, you should mask. Two, it is reasonable to raise that as a question. Knowing people's vaccination status, the same thing as when it gets to other types of conversations about, their risk. What you're trying to understand is what their risk category is. Is this person high risk, or is this person low risk or medium risk? And what that is depends on the individual. So you'd have to ask that question. Is this person saying they are not vaccinated? And what that risk is to you, who they are around. But if it's spreading already in the community, pretty much everybody's at risk, right? So then you have to understand, are they vaccinated? Are they willing to get the vaccine? In the meanwhile, if we're going to date and meet, maybe we should both mask. So we have that understanding. Raise it up as a question. It is not taboo, even reportedly, not on one of those date sites, full disclosure, although I'm single. But the thought is that on those date sites, actually, they're actually asking question. And then there's actually been a status profile bump up for those who are vaccinated. So people are actually asking this, and it is normal. Even the White House did a special where they partnered with the Bumbles and the other multiple outlets that deal with dating. So just be aware of that. I'm done.
And I agree to everything Dr. Dan said. I teach college and I'm an administrator. And when my students asked me, I said, I'm old enough to remember the AIDS epidemic. And there were certain things we asked before we dated. Why not ask these?
This is true. Thank you. Dr. Brooks, did you want to add anything to that?
No, I think that's
Like, I'm married,
that was excellent advice.
Okay. According to the data, this is the next inquiry. According to the data, which is the safest vaccine and why?
I'll jump out there on that one. It's that's a good question. Each vaccine, they're all safe. The short answer to me would be I would get vaccinated whichever one I have the earliest access to. I clearly endorse all three that are on the market right now. But let's look at a little nuance. There is the mRNA vaccine and the heart inflammation issue out there now. The myocarditis related to mRNA. Again, as I said in my opening remarks, for 1 million doses of the mRNA vaccine, you have 8 cases in a girl of myocarditis, 80 in a male of myocarditis. That's 12 to 17, and even less, 18 to 24. And generally speaking, those cases are mild. With the Johnson & Johnson vaccine in females under 50, you did see the PTS, thrombocytopenia, thrombosis syndrome. But again, these were at rates that are like 20 per million. So the chances of these things occurring are really, really low. But if I really were in that situation, probably if I were a female, I may get the mRNA vaccine. The downside of that, J&J is one and done. So people that don't like shots, don't want to go back, the J&J is the one for you. I think that the clear message is, though, these side effects are extremely rare per million, okay? So if you want that nuance, I gave it to you, but the bottom line is, if I were whoever you are, I'd feel comfortable getting any of the 3 vaccines presently on the market.
Okay, and we have a question in the chat. Our last question comes from N. How does vaccination status challenge HIPAA rights? Good question.
That's a tough one. I may ask someone else to weigh in on this. I do know that you can ask people to disclose their vaccine status. When we hire people, we need to know their vaccine status. You need to know whether or not you're screened for tuberculosis. So there are particular guidelines. I'm not truly familiar with them, but I do know that you can request vaccine status. I think it's related to infection control and now with a public health emergency.
Yeah, I'll jump in on that. Well said, Dr. Brooks. I get this question all the time. I actually met with the National Bar Association, literally having this discussion.
Good.
So yes, HIPAA is a big deal. And for all those who are wondering what HIPAA is, it's basically Health Insurance Portability Act. Pretty much what it's saying is that, don't be in people's business, at least when it comes to medical issues, and you don't want to disclose their status or what's going on in their medical life. That's the long and short of it. So certain people can only share that information within a controlled setting with your consent. Got that. The piece that's with regards to this card, yes, you can ask that if you're a private entity. Public entities can't necessarily do that, is what we've come up with to understand. So your school, you have to have vaccines for flights to certain countries, and they're actually literally talking about having it on every carrier flight. So that's coming down the pike. So don't get it twisted. It's going to happen. So they have the right to ask that, and for any private entity, in fact, the NFL, and I'm actually having a conversation on this later on today, who's leading us out the pandemic, and the NFL just put that out there. The owners, while they're not, in my opinion, not being altruistic about it, they're doing it just to say, hey, we trying to protect our pockets, and we also want to make sure the pandemic is over so we can still have the football games go on. So same thing for schools and for other entities. So people are going to follow. Disney follow suit, Walmart's follow suit, and all these corporations, once they start to get it, it's just going to trickle down. So the short of the answer for you is that yes, entities, organizations, businesses, universities can ask, or your boss can say, hey, I want to know the vaccine status. You prove that you are vaccinated by vaccine card. They won't get into all the other stuff, but during a public health emergency, given all what's going on, they are within their right. And so far, the courts have not overturned any of that, especially for hospital systems, but even a few businesses have prevailed over that, given the pandemic. But we'll see what happens. Sorry about that.
If I may add
I
real
need to
briefly.
say about
Go ahead, dear.
colleges is that parents don't know they have the power with the colleges right now. And that's what I'm constantly urging parents. They have to ask questions, and they have to be able to say yes or no to what the college policies are, because they have the power. And we're seeing that in Jersey and Pennsylvania. So if parents start saying, I want, and for us as professors to have the shots and a notification, parents have the power. That's what I keep telling them. It's your tuition money that keep it open to college. If we're not doing what you need to do, then we'll all end up closing down.
You want to add, Dr. Brooks?
Well, I was just going to say that, ultimately, if you don't want to disclose, you just, like, for example, won't get on that plane, or you won't go to that college. I mean, if you feel strongly enough about protecting your vaccine information, then that's what will happen. You get just barred from that particular entity.
Yeah.
And I also want to say that that's very concerning, because what it could potentially create is a class system. Again, we already have a class system in a sense, people are disenfranchised, right? So this further can lead to a problem that further disenfranchises folks. So it's become like the vaccinated or the unvaccinated, and then you get access. I mean, you get the VIP level, you got vaccinated, you get the mezzanine or garden level, or you don't even come in here at all. So those types of things people really have to think about.
But don't you think, Dr. Dan, because it was politicized from the beginning, we're already there?
Pretty much, but they had to put all those things in place. And this is the time where it's going to come in place. Fall, winter, it's going to be a new game. We're going to have a different story to talk about.
Yeah. Yeah.
Wow. I was just going to add that I can testify as I just took my COVID test to get on my plane tomorrow. So no COVID test, no land of the happy island for me. Oh, thank you so much. It's an honor. I'm like a geek and I'm like, starstruck with all of you here. But now I'm going to turn it over to Miss Zenobia Moss, our awesome sister in NCNW. Thank you so much for your expertise.
Thank you.
Thank you.
Special thank you to all of our amazing chat room experts and our moderators. And again, it's such a pleasure to be a part of our NCNW Health Equity COVID Subcommittee and the work that we've been able to do under the leadership of our very own Dr. Angelia Elgin. At this time, I have the pleasure of introducing to you all someone who has continued to be our leader with Dr. Cole. Is our Executive Director, Janice L. Mathis, Esquire. Ms. Mathis, we want to turn it over to you. And immediately after Ms. Mathis, we're going to finish up the raffle. But we just want to thank everybody for such an amazing, amazing national town hall. As we've shared, is the first of 4. And so we are delighted that you joined us today, but please stay with us to the very end as we give out the rest of these raffle prizes. Ms. Mathis, on to you. If we're still waiting on Ms. Mathis, if we have the opportunity, we could do a couple of the raffles. We are waiting on Ms. Mathis.
I was talking away and did not realize that I was muted. I am so sorry. Let me hurry because it's already—
And your camera.
It's already 2 o'clock.
Thank you.
So let me begin again by saying thanks to everyone. The predominant emotion that I feel is gratitude. First and foremost to Dr. Angelia Elgin. We owe you a great debt of thanks for your vision and leadership. Today's town hall meeting could not have occurred without it. And today's town hall has been, I think we would all agree, an unqualified success, thanks to your dedication and your expertise. Part of Dr. Elgin's vision was to make this a national event. Today, based on comments in the chat, we have NCNW members and leaders from Maryland, Virginia, California, North Carolina, Pennsylvania, Mississippi, South Carolina, New York, Connecticut, Illinois, Georgia, Ohio, New Jersey, Florida, Wisconsin, and Missouri. And so the message was even carried live on Facebook. I want to thank the entire COVID subcommittee for your energy and commitment and dedication to today's program and the ongoing work of the subcommittee and the entire Health Equity Committee. Dr. Cole and the entire NCNW family appreciate your willingness to serve a great cause. Dr. Cole often says, if you want to go fast, go alone. But if you need to go far or you want to go far, go together. As you can see, it took a large and dedicated team to present this town hall. Members, officers, affiliates, Health Equity Committee, speakers. We have a long way to go to achieve the ultimate goal of health equity for everyone, including women of African descent, their families and communities. But we have a team that is up to the task. Putting together a team is not easy, but we know for sure that team means together everyone accomplishes more. NCNW has a dedicated staff, but we mostly depend on volunteers. Ms. Moss, Ms. Osei, Ms. Green, Mr. Johannes, our Director of Communications, Ms. Allen, Ms. Price, and the entire NCNW staff, we thank you for your contributions to today's effort. And I would not be remiss if I did not acknowledge the presence of our affiliates. At least I saw the National Association of Black Nurses, the Continental Societies, including their president, and Zeta Phi Beta sorority, and perhaps others as well. And finally, I want to thank the audience for joining us. There are a lot of ways to spend a Saturday afternoon. We know your time is precious. We thank you for spending it with the COVID subcommittee of the NCNW National Health Equity Committee. If you learned one useful thing today, please share, follow NCNW, or host a watch party. And if you want to make a difference, if you want to know more about health equity, if you want to be an advocate, there is room for you in the Good Health Wins team. Consider visiting www.ncnw.org and perhaps even joining NCNW. We thank you, and I turn it back to Ms. Moss.
Thank you so much, Ms. Mathis, and to everyone for an amazing National Town Hall session today on COVID and children getting back to school. And now it's time for us to get back to our raffle. We are going to raffle off 14 prizes, $100 prizes. Don't let the wheel fool you, you all. It's 100. And during each of these 100, I want to be able to say, thank you for being with us today. And so our first prize goes to Alethea Young. Congratulations, Alethea Young. Thank you so much for joining us. And our next prize goes to, and these are $100 gift cards, Visa gift cards. Viola Slaughter, thank you for joining us. And our next one goes to, thank you all for joining us, and we hope that you will be with us for our next three. And the winner is Reba Holmes. Reba Holmes, thank you for joining us. Be on the lookout for our next National Town Hall. Will be on COVID and maternal health, specifically looking at pregnancy and issues related to maternal health. Our next winner, Vivian Morton, thank you so much. Vivian Morton. Our third town hall will be on COVID and mental health. We are looking forward to that as well. Our next winner is Elvina Colbert. Elvina Colbert. And at the end of the year, our final town hall will be on COVID and the long haulers. So please, when you get the registrations, join and be a part of this with us. The next one is Maddie Stevens. Maddie Stevens, thank you. Congratulations. You're a $100 Visa card winner. Next. This is a lot of fun. James Hawthorne. Okay, thank you. I think it's Hawthorne. Thank you, James. And these cards will be sent to you electronically, so please look in your email. Our next winner is Barbara Oldwine. Barbara Oldwine, thank you for joining us today. We really appreciate all of our friends, family members. Please share this information. If you want more about the recording, you can go to ncnw.org or goodhealthwins.org. Our next winner, Maya Smith. Maya Smith, thank you, Maya, for joining us today. We hope that if you'd like information regarding our children birth to 5, our school age, or our college information, all of the additional resources will be in our chat room, from the chat room, and also on our website. Mary Wedgeworth, congratulations, Mary Wedgeworth. We have 4 more, I believe. Mary Wedgeworth.
Ms. Moss?
Yes.
While you're spinning the wheel, I learned that the top ladies of distinction, Alpha Kappa Alpha Sorority Incorporated, and the Links are also joining us today from our affiliate body.
Thank you. And thank you, Cassandra Conover. Thank you. We know that there have been so many, I've received so many emails and chats. Thank you all for your continued support. I especially want to thank the Good Health Wins state leaders for helping us to get this information out in communities across the country. We have Lois Jackson. And we have 3 more to go. Lois Jackson, these are 100 Visa prizes. They will be sent to you digitally. Thank you. Who is this? Looks like Shay Suber. I'd be remiss if we didn't thank our fearless leader, Dr. Janetta Besh-Cole, in her absence, for being with us in spirit and for giving us the leadership to continue to do the work that we do, along with our executive director, Ms. Mathis. Thank you all so much. Anita Reed, you're a winner. Right. We have one more to go. I also would like to thank the members of the NCNW Executive Board, the NCNW Health Equity Committee, our COVID Subcommittee. Sisters, this was amazing. And to our brothers who's joined us, thank you as well. I believe this is our last winner, Aura Easley. Aura Easley. Thank you all so much from the bottom of our hearts. We appreciate this, and to all of our panelists. Dr. Elgin, would you like to close us out?
I would be honored. I want to, my dog wanted to close us out as well. I just want to thank Sister Mathis, my committee members, as well as all of the panelists that were on our panel today. We must remember that we still have to maintain our due diligence, maintain our social distancing, continue to wear a mask, get the vaccine. Those are three important things that are so important that we to continue to maintain adequate health. So without further ado, we have 3 more series coming for you. So please stay tuned. Thank you again and have a blessed weekend.